Nursing Union Denosa has added its objection to comments by the Limpopo Health MEC about healthcare staff lazing around and not doing their work. You remember MEC Phophi Ramathuba was captured on video scolding a clinic workers for sitting idle while patients waited in long queues. Denosa says the comments are unfair and don't accurately portray the events at Rethabile Clinic in Polokwane. I'm joined now by Denosa chairperson in Limpopo, Lesiba Monyaki, who wants to set the record straight from a union perspective. Lesiba, good afternoon. Welcome to today on ENCA. Was the MEC wrong for cracking the whip?
Thank you and good afternoon, brother. First of all, there was no whip to be cracked there. I think the MEC, we don't actually know what was happening about our MEC, because in actual fact, she should have gone there to gather facts. Of course, she might have had a whistleblower, but she should have got her facts straight before she recorded that and brought this to the larger media.
But she saw your members, who are nurses, sitting idle when patients were waiting in a long queue without being serviced.
Which is not correct. It's 100% wrong and misplaced. It's not correct. Because the nurses that she was talking about, which nurses? Because that clinic is grossly suffering from shortage of staff. So the nurses that she was talking about, we had only 3 midwives. There were only 3 midwives at that particular area. And those 3 midwives, 2 of them were conducting a delivery, of which a scope of practice dictates that during a delivery, a woman in labor must be attended by a minimum of 2 midwives. So the 2 midwives we are talking about the normal labor. So the woman we are talking about was having a difficult labor, in which we expected ordinarily we should have been having plus minus 4 nurses around, 4 midwives around that patient who is in labor. But at that time, we had only 3 midwives. 2 midwives were busy with that person, with that woman on difficult labor, and the other midwife was helping other patients who were on the queue. So those 3 midwives couldn't multiply to 9 or 14. That's why we are saying we want to set the record straight, because the MEC is a medical doctor, not a nurse, not a midwife. She doesn't know our scope of practice.
Are you saying that it's an unfair criticism because you need resources that you don't have? And if that's the case, has the clinic tried to get those resources? Because there have been complaints about lack of service to patients at that particular clinic.
That in itself, Brad, then it's not a clinic, it's a CHC, Community Health Center, which it's supposed to be operating 24 hours. This morning I went to the clinic. At that time, there was not even 1 doctor there. Patients were waiting from 6 o'clock, waiting for the doctor. We don't see her whipping, cracking a whip on some of the colleagues. We are not encouraging her to do that, because such behavior is out of order, is unbecoming actually. So but in actual fact, that clinic is now operating at the level of a clinic, whereas it should be operating as a community health service, as a health center. But now the problem is gross shortage of staff at that clinic. And for the past few months, the department has been advertising posts, but never for that clinic, whereas it has got gross shortage of staff.
Have you told, as Denosa, as we are concluding, Lesiba, have you told, as Denosa, the MEC, that she needs to deploy more resources at that particular health center?
It is a well-known fact that it's our chorus as Denosa. If you check all our past 4 or 5 media statements, we are always complaining about shortage of staff, gross shortage of staff. To make it worse, in this province, we've got more than 400 clinics. And of the 400 clinics, only less than 20 of them are operating 24 hours. The reason why the other 380 or more are not operating 24 hours is because primarily because of shortage of staff. And Rethabile is one of those. So she cannot just go there and then, come with her videos and cameras to capture our nurses and harass them, whereas she knows the main cause is shortage of staff at that clinic.
besides talking to us and reacting to her moves, and which she believes were justified, what are you as Denosa going to do to make sure that patients do get service?
That's why today we went to Rethabile. Actually, we went last week immediately after the incident as Denosa. We went there to check, I mean, how our nurses coping, and we also check the staff composition. It was shocking. So, but now we are intending to have a meeting with her. We have got many. It's many times that we are trying to call a meeting with her, and she's sometimes, if not always, available to have a meeting with Denosa. So in this case, we are still believing that she will come to the board so that we can assist in this department, because those are our members, and the community is also our people that we must take care of. Yeah,
because it doesn't help the patient that you are pointing a finger at her. She's pointing a finger at you, saying your nurses are not doing their work, they're sitting idle. The patients just need the service. Hopefully you'll have that meeting as soon as possible. Thank you very much for your time. Lesiba Monyaki is the chairperson of Denosa, the nursing trade union in the province of Limpopo.